Hello friends, let us now learn some important points about HIV therapy. So in the HIV therapy, first HIV therapy. So in this we are going to learn about highly activated HIV therapy is also called as highly activated retroviral therapy. This HIV therapy is started as soon as diagnosed. If there are any symptomatic patients, it is done in any symptomatic patients regardless of their CD4 count. Earlier, this highly active antiretroviral therapy is important. Earlier we used to give it according to CD4 count. That is, earlier if you see, the treatment is started only if the CD4 count are less than 500 according to WHO, or if the treatment is started if CD4 count is less than 350 according to NACO. Both these are earlier guidelines, but now we will start the antiretroviral therapy as soon as possible. Then if you see the drugs, we use three different three drugs are used from two different classes, that is 2 NRTIs plus 1 NNRTI is used. Zidovudine, lamivudine and nevirapine together are preferred in India. So if you see in this, zidovudine and lamivudine are the 2 NRTIs. This can be combined with nucleotide reverse transcriptase inhibitors. Then we have zidovudine plus lamivudine plus tenofovir can also be given, that is NRTI plus NTRTI plus NNRTI together can be given. Then we have tenofovir and lamivudine. We can also combine tenofovir, lamivudine and efavirenz can also be combined together. These are the three regimens which are available. Even more regimens are available, but in India we prefer giving zidovudine, lamivudine and nevirapine together. Then if you see the next important thing, we will see in pregnancy first and then go to post exposure prophylaxis. In pregnancy, the combination which is given it is started as soon as diagnosed, and in pregnancy there are no contraindications. The combination which is given in pregnancy is lamivudine with efavirenz with tenofovir. The combination is lamivudine, efavirenz with tenofovir together we give in pregnancy. Then we have post exposure prophylaxis. Post exposure prophylaxis is if there is needle stick injury, that is HIV needle prick injury. It is important. So in HIV needle prick injury, here the risk of transmission of HIV is around 0.3%, risk of transmission of HCV is 1.8%, risk of transmission of hepatitis B virus is 30%. So these post exposure prophylaxis are actually the prophylaxis, they are started as soon as possible. So we will see the basic regimen. Basic regimen include zidovudine 200 mg TID should be given with lamivudine 150 mg BD for 4 weeks. Zidovudine should be given with lamivudine for 4 weeks. Then we have expanded regimen. In expanded regimen, we can give zidovudine 200 mg TID with lamivudine 150 mg BD along with the drug indinavir, which is 800 mg TID can be given. And we can also give protease inhibitor, which is saquinavir 1200 mg TID can be given. All these are given for 4 weeks for expanded regimen. We can give these drugs are started as soon as possible or must be started within 72 hours. So in pregnancy, as I have already said, we can give lamivudine, efavirenz and tenofovir together can be given. One important thing to clarify here is, because you might get confused, See, in the basic regimen, we give two drugs, zidovudine and lamivudine, in the prescribed dosages for 4 weeks. Then in expanded regimen, we give zidovudine and lamivudine. We give with zidovudine and lamivudine, a third drug is added, which is either indinavir or saquinavir. This is or. One protease inhibitor is added, which is either indinavir or saquinavir. We do not add both. Okay, so in basic regimen we give two drugs, zidovudine 200 milligrams TID plus lamivudine 150 milligrams BD for 4 weeks, whereas in expanded regimen we use three drugs for 4 weeks, which is zidovudine 200 milligrams TID with lamivudine 150 milligrams BD. Along with that, we will also add a protease inhibitor, which is either an indinavir or saquinavir. Indinavir can be 800 milligrams TID or saquinavir can be 1200 milligrams TID. All these are given for 4 weeks, right? So this post-exposure prophylaxis is started as soon as possible, and we should start it within 72 hours. So in pregnancy, we give lamivudine, efavirenz plus tenofovir, as I have already told you. Now, in pregnancy, one more important thing is about the labor. In pregnancy, if the patient is in labor, we should do elective C-section to the patient. We should not do normal delivery. Here 200 milligrams of nevirapine is given for the baby for prophylaxis. So this is about the important points about the antiretroviral therapy. Thank you for watching.